I'm Dr. Karishma Chawla, and today we are going to start with a series of congenital disorders. So congenital disorders are a little difficult to understand, but once you learn about the embryology, how we are developed, you will be able to understand the disorders much easily. So first we have to cover a little part of the embryology. So in the embryology, how are we made? We are made from a single cell, right? So first, what is developed is a neural tube. Okay, this neural tube over here in the green, this is the first thing that is developed. From this neural tube, there are two extensions, two cells which are born, which is the sclerotome. Okay, these sclerotomes on the lateral side, and then the dermomyotome. Okay, these are the two things which are very important, which are given by the neural tube. Okay, then there is neural crest, there is notochord and ectoderm. But for us, what is important is the sclerotome and the dermomyotome. Okay, to understand the disorders of the congenital system. Okay, to understand the congenital anomalies. So sclerotome is the structure from which all the bony structures will be born, like your bones, your vertebrae, everything is going to be formed by the sclerotome. Okay, then dermomyotome, as the name suggests, it's going to develop the skin, derma, and myotome, it is going to develop the muscles. Okay, so hence dermomyotome. So this is the basic structure. Okay, so once it is divided into this structure, what happens? From the sclerotome, small projections are made on the fetus. Okay, these projections are called limb buds. These limb buds are responsible for the development of our limbs. Okay, first it is just a bud, it is just a projection like this. Okay, I've attached a image over here somewhere, and you can see it is just the bud-like structure. Okay, and this bud-like structure is formed around 5th week. Okay, from this bud-like structure, once it starts growing, okay, it is just a bud, but now it will start to grow into limbs. So once it starts growing, what will happen? It will form a flattened structure at the end. Okay, this flattened structure at the end is going to be a hand plate or the foot plate, which is going to make our hands or legs. But till now at this point also, it has not divided into digits. Okay, this is all just a plate. Okay, it is just a plate, there is no division of the digits. Okay, so it is all webbed, like we are somewhat like birds when we are in the fetus form. We have webbing in between our fingers also. Okay, so these webbing, because our fingers are all attached to each other. Okay, so this is as a whole known as a hand plate and a foot plate. Okay, by the 6th week, this happens by the 6th week. Okay, and what will happen once this foot plate or hand plate is made? You will have a dividing structure or a constriction band over here on your wrist or your foot. Okay, so what this constriction band does is it will divide your hand structure from your forearm, so that there is movement at this structure. Okay, so that you can do a movement over here. Same you will find at the elbow, but it is going to be less, because here the movement is like this only. Okay, it is not a circumflex movement that is required over here, wrist. So what will happen? Sometimes you can see when the child is born, that child is having a deep crease over here. Okay, that is a constriction band, but it is not a constriction band when the child is born. It is just a crease, but when it is formed, it was a constriction band. So in some children, these constriction bands are so taut, they are not able to open it when as the child grows. So what will happen as a result? There is decreased there is decreased nutrition at the ends. Okay, sometimes in these cases there is auto amputation of the whole hand, or there is auto amputation of a finger, or there is not enough nutrition to develop the structures. So maybe a finger might not be there, two fingers might not be there. That is known as syndactyly or polydactyly. Polydactyly is if there is multiple number of fingers which are not present, which are absent. Okay, if it is single dactyly, that means single digit is not present. Syndactyly. Okay, single digit is not present, that is syndactyly. So this all happens because of this constriction band syndrome. Okay, so this is why these constriction bands and this development is very important. So before actually growing into digits and everything, which happens around 8th, 9th week, the digits are formed at 8th, 9th week. So okay, so before it is divided into the whole arm, it is just a bud. Now when the bud will grow, it has to divide into 3 bones over here. We are having 2 bones over here at the forearm and 1 bone at the arm region. Okay, but when we are developing, it is a one single structure. It is a one single cartilaginous structure which is not even ossified at that time. It is just a cartilaginous structure, and that cartilaginous structure is going to divide into 3 parts. One is going to be your humerus, then it is going to be your ulna and the radius. Okay, but this has to go into mutation. It has to divide into 3 parts. Okay, if anything happens, maybe because of the chromosomes, genetic disorder, some kind of genetic disorder, some kind of constriction, there some kind of restriction in the movement, okay, or some kind of injury, gestation insult, okay, all these reasons could be there. Because of any of these reasons, if the bone or if the growing structures are not having enough nutrition, they might not divide into these bones properly. What will happen as a result? Sometimes the patient is having shorter humerus, shorter ulna, shorter radius. Okay, the whole arm is shorter, or sometimes it can happen that it is not able to divide properly into radius and ulna. Okay, the radius is absent. Okay, sometimes the ulna is shorter, sometimes the radius is shorter, sometimes there might be fusion between the radius and ulna, because the radius is, first it divides into 2 forms, like first the humerus is going to be there, and then a single bone as radius and ulna, and then that radius and ulna is going to divide into 2 bones. Okay, so when it is divided into radius and ulna, it is going to be joint. Okay, it is going to separate from the distal part and it's going to be joined on the upper part, and this joint has to divide. Sometimes this joint is not able to divide properly, then also some kind of congenital disorder happens. So this all happens during the development period. Okay, so if anything goes wrong during this development period, it will result into problems. Okay, so once the whole arm is formed from that single bud, now at that time, as you know, I've attached an image of the fetus. The fetus is like this. Okay, the legs are in the Bharatanatyam position, like open. Okay, and the hands are like this. Okay, so from this position, the fetus has to come to the normal anatomical position, right? He has to attain that anatomical position. How it will happen? It will happen because there occurs a rotation of the limbs at the 7th week. At the 7th week, what will happen? Our upper limb is going to rotate laterally like this. It is going to open like this, and our lower limbs, which were like this, okay, like this, it is going to come like this. Okay, so that we can stand like straight. Okay, for standing straight, it will be coming like this. Okay, so what will happen? Earlier, everything like the flexors were in the anterior part and the extensors were in the posterior part. Now when this rotation happens, our extensors for the upper limb are going to be posterior, flexors are going to be anterior, but in the lower limb, our extensors are going to be anterior and the flexors are going to be posterior. Okay, what happened? From this position, when it turned like this, our extensors came from back to front. Okay, now that is the reason why our extensors are going to be in the front. Okay, so if that doesn't happen, our biomechanics, if something happens during this process of rotation, our biomechanics are going to be altered. Okay, the muscles are not going to be formed properly, nerves are not going to supply properly. Okay, so something can happen during this process also, and that can also result in some kind of congenital anomaly. Then it is not just the muscles or the rotation, it is going to define our dermatomal pattern also. This rotation is going to define our dermatomal pattern also. Okay, so when it was just the limb bud, okay, this was just a limb bud, so the dermatomal pattern was very easy. Okay, it is just going like this, C2, C3, C4, C5, C6. Okay, it was in a linear fashion. But as humans, we don't like simple things. Okay, we want to complicate our lives. So what happened? We developed limbs. Now, as we developed limbs, it was still going in a linear pattern. Okay, and we thought it is still not complicated enough. Why? We have to complicate it. So we opened our arms. Okay, so as we undergo this rotation, the dermatomal pattern is going to be divided into a haphazard manner, which is very difficult for us to learn. We all know the struggle we had. Okay, so what happened? Now there occurs a race between all the dermatomes. Who will reach the last? Who will reach the end parts? So here, like you can see a limb bud. Who won the match? C6, C7, C8. Who won the match? Who showed the middle finger? The middle finger is shown by the C7. Okay, so C7 won the race. C7, okay, it won the race. So that is how, when they were having a race, C5 just ended here. It dropped out. Okay, C6 went till here and dropped out. C7 reached the end, followed by C8. Okay, to the thumb. So that is how. Then in the lower limb also they are going to have a race, and they are more cooperative and mostly they are going to reach at the same time. So your L4, L5 and S1 are going to reach your foot. Okay. Others are going to lose in the thigh region or the knee region or the buttock region. Okay. So that is how our dermatomal pattern was also developed when it got into rotation. Now the dermatomes are going to go in the fashion of rotation. Then the nerves had to supply the regions. How are they supplying now? It was like this, the radial was coming here, it went like this, the radial went on the posterior aspects and the ulnar and medial went into the anterior aspect. Okay, again this happened because of our rotation. Earlier the three nerves were leaving at the same line of action. First they were leaving together, but because rotation happened, the radial had to go in the posterior position and the medial and ulnar has to go to the anterior position. Okay, so in some cases, if in the development process the radius is not there, okay, so what will happen to the radial nerve? Sometimes this radial nerve is going to just end here. It is not getting its path. It will not win the race. Okay. Then another thing that happened during the our embryology, our development, what happened to this dermomyotome? This was very important. Okay, what happened to this? It is actually a combination of dermatome and myotome. Okay, dermomyotome is going to be a mixture of the cells. It is not divided into anterior and posterior, but it is going to be a mixture. So what will happen from the anterior part or the ventral part, there is going to be development of epiaxial portion. Epiaxial portion it is a dorsal portion which is going to supply the extensors of the vertebra. Okay, and from the hypoaxial portion of this, it is going to supply the ventral part and it is going to supply the flexors of the vertebra. Okay, now if this one of the part is not developed fully, what will happen? Our flexors are not developed fully. Okay, what will happen? Our extensors are going to be more powerful. So the posture is going to be different. Okay, it is going to be abnormal. Again, if the extensors are not very strong, okay, the extensors are not developed fully, what will happen? Our flexors are going to be overpowering. The posture is going to be like this. Okay, this is also a congenital disorder. So this all happens during the development. Okay, anything goes wrong during the development is going to form the disorder. So let's now come to the main topic, that is your congenital